I just gave a talk for perimenopausal women, specifically regarding triathlon. Everything you need to know from a medical doctor who's also a hormonal health expert on perimenopause. I wanted to share some of the highlights with you because I know so many of you would be interested. Our perimenopausal years are really this critical period in time where you really at the peak of your life, peak of your career. You're at this point in time where you want to test your limits, where you have wisdom, maturity. You're really at that time where you can do things for yourself. You're maybe now at an age where your kids are not as little anymore, and you can get out early in the morning, go train, do your own thing. It's an incredible time in our lives. But then this is also a time when you really want to nourish your body. You want to do things in a smart way. So I get a lot of triathlon athletes who come to my clinic who would say that they train so hard, they spend so many hours training, and they still carry around some extra weight. Why? What's happening? How can they be carrying around extra weight if they train this hard? There's many different reasons. Usually when we look at athletes, we do some in-depth testing. I don't guess. I really do testing. So at our wellness clinic, here in Oakville, we do a lot of functional medicine testing. And I recommend that you try to reach out to a functional medicine doctor near you. You can look at ifm.org and look at the different types of testing that they offer, specifically regarding hormonal health, nutritional deficiencies. If you are low in albumin, low in protein, low in magnesium, low in calcium, if you're low in anything, low in vitamin D, if your thyroid level is a little bit off, any hormonal concerns, then your body won't be able to perform at optimally. So something that I would often see would be, say, low magnesium. Then if your magnesium is low, your body will crave something and you'll eat more and eat more to try to fill those stores. So that's quite critical. That's something to make sure that you don't have nutrient deficiencies. If you do have nutrient deficiencies, you want to investigate a little bit. Why do you have nutrient deficiencies? Do you have adequate intake? If you do have adequate intake, does your body absorb these nutrients well? Do you maybe have leaky gut? For quite a lot of our clients, then would start working with a nutritionist. How do you heal your gut? How do you optimize your intake, your nutrition intake? So that's quite key. The first test, do some testing, make sure you don't have nutritional deficiencies. Next thing is there are certain things when you were younger, you could not train for 6 months, then one day hop on the bike or go run 10 kilometers and you would be fine. During the perimenopausal years, we find that there's some laxity in some of your ligaments. You might get injuries easier. You might have joint pain easier. So to really look out for that. If you have joint pain without training, then you might want to see someone doing a workup for autoimmune disease, see if it helps you to go on an anti-inflammatory diet. Those things are big. Okay. Then next, so we look at joint pain, we look at your optimal nutrition. We often, for female athletes during their perimenopausal years, we really want to look at optimal protein intake. So yeah, at Wellness MD, I've done more training in lifestyle medicine. So everyone who walks through the door, I would say to try to avoid processed foods. That would be foods that's made in a factory, and focus on whole foods. Whole foods are the way that you see food on a farm. It is real eggs, veggies, things that are like a real food. However, the caveat though is with most women that I work with, when we track their nutrition intake, we have this very cool app we use at the clinic where people can just take pictures of all their food. We can scan your nutrition intake. We often find that women don't have adequate protein intake. That's usually the number one reason why they have a hard time losing weight, because they don't have enough protein. Then their body with workouts would break down their own muscle, and that's where you get, when we do your body composition, you'll have less muscle and more fat. That would slow down your metabolism. Okay, so when we look at your protein intake, that's the only area where I would say, okay, maybe it's okay to use processed foods in the form of protein powders. There's so many protein powders now. You can have a look at our website. I really try to find clean protein powders, free of additives, free of anything harmful for your body. But good protein powders, you're not going to replace your meals with protein powders, but that might be just an extra when you see that you didn't meet your required protein intake for the day. You might just add on a protein shake, make yourself a spinach smoothie, add a scoop of protein powder just to meet your macro needs for that day. Then the next thing that we really discussed and then is how the way you're exercising, is it in a way that your body is benefiting from it, or is it in a way that it's harmful for your body? So a good way to look at that is to look at your heart rate variability. Your watch can easily track that. Something else we often look at is, I really like the 80-20 rule, where you spend 80% of your training in a lower, less intense, and only 20% of your training more intense. There are so many things you can do to take your training to the next level. Electrolytes is something that, to make sure that you don't just replenish fluids, but that you replenish extra electrolytes, that you have off days, days where you just relax, days where you do things for fun, not just for training. Go on that fun bike ride with your friends, go on that fun hike in the woods where you're not as focused on training. Make sure you get adequate sleep. That is something I really work on during the perimenopausal years. Something quite a lot of women might need estrogen for is to avoid hot flashes when they're asleep. Progesterone is very good to aid in sleep. These are things that you really might want to have a look at in your perimenopausal years, things that might be different, how you might train a little bit different than you were used to. There are so many things you can do to take your training to the next level. I chat quite a bit about that in my book, Thrive Through Menopause, very easily available on Amazon. It's Thrive Through Menopause. Lots of things you can do to thrive through menopause, and also thrive through your athletic career in your perimenopausal years. And then on our website, www.wellnessmdhealth.com, there's online courses, Menopause 101 and Triathlon 101, things that you can easily do for yourself, even if you're not on Ontario, or you can access one of our healthcare providers at the wellness clinic. These are things that you can easily work through on your own to take your game to the next level. Thank you so much for watching. Please comment below or email us at info@wellnessmdhealth.com if you have any questions. Take care.